Dr. Bang is not there.
Kunal
Dr.
Mandli.
Mandli. Dr. Mandli.
Thank you, judges and AIC for the opportunity. So my topic for today is use of topical tacrolimus as an adjunctive therapy in mycotic corneal ulcers. So as we know, infectious keratitis is most common cause of vision loss in developing countries, and in severe cases, we need to do therapeutic keratoplasty in those cases. Tacrolimus is a potent immunosuppressant of T cell proliferation. It uses inhibition of calcineurin signaling pathways. It has both anti-inflammatory and antifungal properties. So our aim of study was to determine the addition of topical tacrolimus in patients who underwent therapeutic keratoplasty for fungal ulcers, whether it was beneficial in terms of graft clarity. So in all, 13 patients were screened with smear and culture positive for fungal ulcers who required therapeutic keratoplasty, these patients were already on topical natamycin hourly, and post-therapeutic keratoplasty, we added tacrolimus ointment 0.1% thrice a day, along with cycloplegics and analgesics. The patients were followed up until 3 months. So the average age of our patients was around 62 years, and mean duration of the symptoms of presentation was around 9 days. Only one patient had pre-existing history of diabetes mellitus. So we did culture, we got culture on agar. These are our results, like 3 were fusarium, 5 were aspergillus, and 1 was pseudosporium. Rest were culture negative. So the average size of our ulcer in the patients was around 7 mm. So considering the size, average donor graft was around 9 mm, and in 8 cases we had removed the crystalline lens during therapeutic keratoplasty. So we had used optical quality graft. So our average cell density of donor corneal buttons was around 2,400. And in those 2 patients required regraft due to graft reinfection. After 3 months of follow-up, we found that 2 had clear graft, 2 had mild edema, and 2 had moderate edema, whereas 3 had severe edema. Except for 2 patients, other patients had good anatomical integrity, which had a good potential for optical keratoplasties. So in clinical implications, we can say that topical tacrolimus is efficient in controlling post-operative inflammation after therapeutic keratoplasty. Unlike topical steroids, we normally are doubtful whether to start them or not because they can precipitate recurrent graft infections in fungal keratitis. So in literature, we have Zhang et al. From China. They also did a retrospective analysis of 20 patients where topical tacrolimus eye drops of 0.1% were administered 4 times per day. And they also concluded that topical tacrolimus facilitated in reduction in intraocular inflammation, which extends the long-term survival of the grafts. So few limitations of our study, as it was like a pilot study, the sample size was small, so it requires a prospective study with a large sample size, which we are undergoing at present with this group which we collaborated for MUT1 and MUT2 from Arvind. So a long-term follow-up is already, the study is going on now. So in conclusion, the use of topical tacrolimus might have beneficial effect on graft outcomes and improving the survival rate and reducing the graft reinfections. Thank you.
So what do you think are the other factors that can affect the outcome of keratoplasty in fungal keratitis?
Maximum, first is the graft quality, optical tissue, what we use.
Now, host, first tell me about the patient's condition. The
Patient
host,
condition,
yes.
yeah, the inflammation, how much the graft size, infiltrate size. If the infiltrate is more than 6 to 7 mm, the inflammation in the anterior chamber inflammation also counts for that. If anterior chamber inflammation is more, then we can expect a bad outcome in the post-operative phase. Because of the higher inflammation, there are immune melts also seen in post-therapeutic keratoplasty. But we don't, in cases of fungal keratitis, post-therapeutic keratoplasty, we are very doubtful to start steroids to
No,
reduce
that
that
is fine.
inflammation.
That is fine. But what are the host factors that can affect the outcome? My question is, what do you think are the factors in the host? One you said was the size of the ulcer.
Yeah.
The
And the
few
host
other
immune
things.
mechanism, that's
No,
why we are
that we
suppressing
cannot
that.
see.
Yeah.
That we cannot see in slit lamp. So what are the other factors that we can see and know that
The AC
this?
reaction, the hypopion in the anterior chamber, that that concludes that the intraocular inflammation is high. If we find exudates beyond the iris plane, if it is keratitis along with endophthalmitis, that means that the inflammation is high in the eye. So those patients have bad outcomes. So in those cases, additional use of topical tacrolimus can be beneficial. These are just pilot study data.
So what is your outcome? How would you, what would be the outcome, how would you grade your outcome?
So we graded our outcome on the basis of post-op graph clarity. Because we had used an optical clarity graph, so there was no bias that the pre-op cell counts were less, and because of that, the clarity was less post-operatively. So our average quality cell density on the graphs which we used was around 2,400. So it was an optical quality graph.
Post-operative outcome.
Post-operative outcome was good. Post-operative two were clear graphs, where two had mild edema. We graded the clarity of the graft on mild, moderate, severe edema and clear grafts. So like that we graded to see that inflammation was reduced. Because of the high inflammation, normally it leads to graft failures. So graft failures is the
So it
graft
was only the
edema.
graft clarity
Yeah.
that you used as a
You-
reference
as a
scale
reference,
to
yeah.
see the outcome.
Yes.
Thank you.
Yeah. Thanks a lot.
And how many cases you have told?
13.
13.
Ideally,
13.
actually we had taken 15, but two
Oh,
patients dropped out. That's why we removed the two patients from that. Now we are with the Proctor Foundation from US. We are undergoing the long-term trial with that. Those were we did
The
the
MUT.
MUT 1 and MUT
Yeah.
2 with them in Arvind. Thank you. Yeah.
No questions from the audience. Sorry. Not in a competitive session.
Thanks a lot, Nav.
You can't entertain audience questions. You ask him afterwards.